I'm Dr. Carrie Lam, this is Dr. Michael Lam. We're talking about snacking today. A recent study has shown that 90% of men and 91% of women eat at least one snack daily. Stress is a major influencer for our eating behaviors and habits. The Stress in America survey was conducted on a sample of around 2,000 adults and 1,000 teenagers. And half of these adults reported having actually a snack or overeating or eating unhealthy foods weekly or even more than weekly. With our high stress life as well as the plethora of unhealthy snacking options available, you go to a gas station, you see multiple snacks there. It's no wonder that America's health is declining. And so there are many benefits of snacking as an activity, but you have to know what type of foods to eat and what you're dealing with. I know you have dealt with adrenal fatigue, and sometimes we encourage snacking in adrenal fatigue. Why is that?
Well, snacking is a phenomenon that is both beneficial as well as can be harmful for the person. When a person is in adrenal fatigue, the body is, generally speaking, have a hard time metabolically in balance. So the tendency towards what we call the reactive hypoglycemic type symptoms is very high. What does that mean? That means that the person tends to go low in blood sugar. However, the blood does not show it's low. In fact, the blood show is normal. This type of reactive response frequently happens during the day. And it is very irritable in terms of the symptoms. It causes anxiety, sometimes crashes. And most people in adrenal fatigue, especially in the advanced stages, find it is quite helpful to stabilize their mood, stabilize their fatigue, to have some snacks. And the question really is what kind of snack,
Right.
and what timing, and for which for the person.
Right. So optimally, for timing wise, breakfast should be between 6 to 8 a.m., a snack at 10 a.m., and then lunch at 12, and then maybe another snack at 3, and then dinner at 5 to 6, and then a small snack even before bed, so that your stomach can be full, you will sleep a little better, your metabolism is more stable.
Yeah,
right?
the general concept is you want to keep a very level blood sugar throughout the day, even though the blood levels are within the normal range.
So what are examples of some good snacks that you also take?
My favorites are seeds and nuts because they are high in protein, high in fat, which are slow to metabolize and low glycemic.
And some people also do vegetables with maybe a nut butter, but nuts and seeds seem to be the best, and even avocado toast.
Yeah, I think as far as nuts concerned, cashews and peanuts are perhaps you should stay away. But almonds tends to be very good, as well as Brazil nuts for those people who may want to have a little bit of thyroid support. It really depends on the overall, and with my clients, I map out what specific snacks are good for them because it's case by case. As I said, Brazil nuts has selenium, which is good for thyroid support. But if you have other types of issues, nuts may not be suitable. For example, if you have irritable bowel or you have SIBO, then certain types of nuts are more difficult to digest, for example. So everybody is different.
No. And then what are some bad snacks, right? There's good snacks, but there's also bad snacks.
Well, almost anything you see in the supermarket, other than the nuts and seeds, are less than desirable, but they occupy 98% of the aisles because that is popular and is pleasant to eat.
Anything in a bag or is processed or gluten-based or even caffeine. Sometimes we drink coffee in order to stay more awake, but overdoing caffeine cannot be good.
Yeah, but at the same time, if you're already a person that's used to caffeine, you don't want to stop cold turkey. And then oftentimes, because the body can go into withdrawals and triggers what we call adrenal crashes. So everything really has to be tailored to your constitution, to your state where your adrenal fatigue is, because your snack regimen will change also along the way as you recover.
So if you feel like you're guilty for snacking, don't feel guilty because there are good snacks for you to eat. And we kind of went through the benefits of snacking if you have adrenal fatigue. And if you don't want to feel those lows and shakiness, and after you eat, it's okay to snack in between your 3 big meals.
Good snacks.
Good snacks, all right?
Okay.
So that's our benefits of snacking, your way to health. We're here to empower you on your health journey.